What treatment options are available for CLL?
So treatment today is very, very different than just a few years ago. We're getting farther and farther from chemotherapy. So chemotherapy for a very long time combined with immunotherapy had the main stage in the treatment of CLL. And today we have much more advanced therapies, biologic agents, agents that target specific mutations or specific pathways in the cells and are much more effective than chemotherapy. So today chemotherapy really has been relegated to a second stage, not really used as frequently. So therapies today are based on biologic agents, agents that address specific important pathways in the cells. And some of these are pills, and some of them are infusion. And what happens today is that it's typically a combination of some of them, or sometimes use them by themselves. But therapies today are no longer chemotherapy, more a biologic agent.
And the treatments that have been developed in the last decade to do that are really quite amazing. The degree to which we can control it for people that do start getting symptoms, and there's a long list of ways that it can start to affect someone's life. When that happens, medicines can bring it under control. In some cases can virtually eradicate it to the point the blood tests start to look normal and we wouldn't really know that it was there, except for the fact that we understand that it is a disease that tends to linger and that someday in the future could come back. But that may be the long future. And in the meantime, we can control it really in one of two different strategies. We can do a maintenance therapy, which is a pill, usually a pill with minimal side effects that you just take every day, and you can do that for as long as you need to. And this doesn't control it right away. Over a period of months, we'll typically see the blood counts gradually come down to normal. We'll feel lymph nodes gradually shrink, and one day you'll wake up and realize that you don't feel like you have CLL anymore. You still do, and you still need to keep taking your medicine. But if you're able to do that, and if it keeps working, which it usually does, you can kind of go back to a normal life. There's pros and cons to that approach. It means you're stuck taking a pill, which is not that hard, but it's still something you got to do every day, kind of forever. And so there's been interest in recent years in, can we treat this down to a point that we can stop treatment and leave it alone? And the treatments that'll let us achieve that are a little more intense. They involve some IV infusions. They involve a little more close monitoring and possibly more side effects, but it's a limited period of time. And you reach a point at the end of that treatment, usually about a year, when we stop it. And after stopping those treatments, people do incredibly well in terms of, even following these studies for several years, which is all the data we have at this point, because these are still pretty new medicines. That the vast majority of people haven't had any sign of CLL returning and haven't needed any additional treatment.